lot of time working in like the nonprofit and social service sector here because I'm a social work major. So, thanks. So I found myself drawn to Bernie as a movement leader years ago when I saw him speaking about, corruption in our political system and, the need for a political revolution in this country. I come from a union household, so workers' rights were basically a part of my childhood. And thanks. And I also, like many of you, have family members with, debilitating medical bills. So I think you can all hear Bernie's voice when I say healthcare is a human right. Bernie is the answer, no question about it. Under Medicare for All plan, Bernie's Medicare for All plan will guarantee coverage for every person just on the basis of them being a human. And not because you can afford some expensive plan or because your employer covers your insurance for you. So if you're here to see Bernie, you probably know a little bit about him. Like that his entire campaign's funded by small donations from people like me, my parents, and everybody in the crowd right now. So this also means you know what we're up against. Other campaigns are raising money from millionaires, billionaires, and super PACs that have unlimited amounts of money. Some of them are even holding them in wine caves. So we win elections against big money by organizing people to mobilize and to vote. Now we have an opportunity staring us in the face right now. To win again here in New Hampshire, to build this movement, we have to reach all the people that aren't here today, like our family, our friends, our neighbors, our classmates, our coworkers. However, that alone is not enough. We must get outside of our social circles and our comfort zones and speak to total strangers. It's not as scary as it sounds. They're people just like us. They care about their family, their health, their safety. But we need to meet them where they're at, and where they're at is their doorsteps. So we're gonna go to their doorsteps. We do this every weekend, and we talk to people about issues that matter to them and why we like Bernie and how Bernie is gonna help us take this country back from the billionaire class. So I'm gonna ask everybody here today to please join me in knocking on doors today, tomorrow, and every weekend up until the February 11th primary. So we have 7 weekends, including this weekend. I'm gonna stress that importance again. 45 days till the New Hampshire primary, and it'll be here before you know it. So I'm calling on all of you to join me and one of my fellow organizers, Sophia, at the exit at the end of this event, and we're gonna go knock some doors in Dover and Durham, and we're gonna show people that we're gonna take the country back from the billionaires. Now it's my greatest pleasure to introduce a member of the New Hampshire Executive Council. He's also running for governor of New Hampshire, and he's been endorsed by Bernie and endorsed Bernie, Andrew Volinsky.
Hey everyone, let's give it up for Thomas and all the organizers who are here that he represents. So my name is Andrew Volinsky. My pronouns are he, his, him. I'm here as a second-term executive counselor. I represent Dover, Rochester, Somersworth, and a string of towns in a badly gerrymandered district that runs from here to Concord to Keene. I want to say a couple of quick things about the Executive Council because you're going to elect a new Executive Counselor next year, and I want you to understand how important the job is. So 3 quick things that I've done as an Executive Counselor. The first and probably most important is I blocked the governor's nomination of an unqualified candidate to become the Chief Justice who had a 30-year history of antagonism to reproductive rights. That was this summer. Last week, I called out the governor because he won't agree to a measly 2% a year wage increase for the state's employees, even though some of them, the ones who plow your roads, who are going to be out in the cold and the dark on Monday, make $13.23 an hour. I called them out, and that's the job of an executive counselor. And the last example I'll give you of what an executive counselor does, I did it last week, I did it this week, I'll do it next week, is I asked the governor to get rid of the unqualified commissioner of education who's opposed to public education in New Hampshire. Oh, and I'm running for governor. Just saying. So, yesterday in Lebanon and last night in Laconia, I made clear who I think should be the next president of the United States, and that is Senator Bernie Sanders. So I did it yesterday, I'm doing it today, I'll do it again tomorrow, I'll do it every day from now till February 11th to make sure Senator Sanders gets elected. So we have an awesome responsibility. I know there's some Mainers here, but here in New Hampshire, we have an awesome responsibility to help select the next president. And we need to kick a lot of tires, we need to visit with other candidates, but I did that. And on the issues that are most important to me, income inequality, climate change, education, the labor movement. Every time I did that, I came back to Senator Sanders over and over again. I feel like I'm home. I worked with the campaign in 2016. I was Senator Sanders' lawyer in 2016. I was a national delegate. I couldn't be more comfortable than being here with you today. And I got to say, every one of us needs to get out, as Thomas said, and support the senator in this election. We come at this from different perspectives. My perspective happens to be through the education and climate action lenses. Some of you may know that I was the Claremont School funding lawyer. We fought hard to make educational opportunities widely available across our state to children no matter where they lived, and the inside establishment, and it didn't really matter, Democrat or Republicans, stopped that from happening. And we need change. We need to have a movement. We need to put people in office who are going to advance real change like Senator Sanders. And so on the education front, I'm all in for Bernie. On the climate change front, yeah, you can clap for that. On the climate change front, you'll hear the senator talk about the Green New Deal. It's local, too. There's a utility that would like to build a for-profit fracked gas pipeline to run from the seacoast to Epping. We need to stop that. The time for half measures on the climate is over. We need to take action. We need to endorse the Green New Deal. We need to make real changes on energy efficiency and alternative energy. We need to do it now, not 10 years from now, because we don't have 10 years. So let's support Senator Sanders on that front too. So let me make two last quick points to follow up on Thomas's comment. The way for us to bring about change is to talk to our friends and our neighbors and to meet them where they are. And so as you leave here today, over the weekend, during the week, at work, at coffee, just ask your friends, what are the most important issues for you? And then talk to them about why Senator Sanders is the best candidate for them on the issues that are most important to them. So that's number one. Number two, I have the distinct privilege and honor to introduce the next speaker. The next speaker is Zephyr Teachout. Professor Teachout, this is the coolest thing, ran for Attorney General in New York State so she could sue Donald Trump. What could be better than that? Let me have you give it up for Professor Teachout. you go.
Good afternoon. I am so thrilled to be here, and what a wonderful introduction from Andrew, who really is one of the state's and nation's greatest champions for public education. Thank you for caring for our kids. We share one thing in common, which is that we both endorsed Senator Bernie Sanders yesterday. And I have the great privilege of introducing the next president of the United States today. We're going to talk a lot about healthcare today. I want to tell you a little bit about myself and why I support Senator Sanders for president. As Andrew mentioned, I wanted to sue Donald Trump, but just to be clear, not being New York Attorney General did not stop me. I was one of the lawyers on the first lawsuits against Donald Trump for taking money from foreign governments while he is president and making foreign policy. The emoluments lawsuit. And I teach at Fordham Law School, and my entire career has been focused on fighting against big money, the corruption in our system, billionaires and big corporations having too much power, corporate monopolies destroying our downtowns and destroying the small businesses, union power in our businesses. And I haven't always won every fight. I'm proud that I was cited in dissent in Citizens United. But I cannot wait until we have President Sanders and we all come together to overturn Citizens United and really shift to a system where people have power. And there is nobody who represents the fight against wealthy corporations and greedy billionaires better than Senator Sanders, who's really been doing it his entire career. So when I think about this next campaign, I think about, well, I'll put it this way. I was just home for the holidays. We have a big family, lots of nieces and nephews, 14 nieces and nephews, 4 siblings. And one of my nieces asked my brother, who is Bernie Sanders? 7-year-old. And he said, well, he's kind of the opposite of Donald Trump. And when I thought about that, that's really true, because Donald Trump does everything he can to divide us. He uses racism to divide us. He uses distraction to divide us. And Bernie Sanders is about bringing us together and see what we have in common, how our fights are the same fights, how the rural fights are the same as the urban fights, how people can't afford to live. People can't afford their prescription drugs. People don't feel secure in their work. Those are things that join us, that don't divide us. Donald Trump is kind of the master of distraction, constantly trying to get us to focus on this shiny object or that grotesque object. And Bernie Sanders is the opposite. He is so focused, driven by conviction, so focused on staying the course and talking about the things that really, really matter to people. I mean, have you seen him in the debates? He doesn't get distracted. He focuses on what he can do as president, but rather also what all of us can do in politics. Donald Trump doesn't believe in truth. And it's a really serious threat. He's really trying to destroy our capacity to believe that things can be true. And Bernie Sanders always tells the truth, even when it's uncomfortable. People really trust him, and that's why they love him. I met him actually 26 years ago. I was a 21-year-old, and I saw a note for a brown bag lunch about trade. And I was living in Vermont, and I went to a small brown bag lunch with his constituents where he was explaining why he opposed NAFTA. And he was talking about it in terms of what it was going to do to workers. He's respectful, he's consistent, he's been fighting against for-profit healthcare his entire career. And we're going to talk a lot more about healthcare. I mean, Bernie Sanders wrote the damn bill. So you're going to hear from the expert, but I want to tell you a story about why this matters so much to me. One of my roommates in New York, where I live now, absolutely beautiful woman. She was a freelancer, a few years older than me. Didn't go to her doctor because she didn't have enough money. And so she didn't catch her cervical cancer early. And cervical cancer is very treatable if you catch it in time. So she struggled with cancer for 12 years. She wasn't able to have children because of it. And I was with her when the last few weeks of her life, when she died, when she was 47 years old. And an extraordinary, wonderful light in the world that did not need to die because of our grotesque and greedy healthcare system. We all have stories like that. Well, maybe we'll hear some of them today. I know 1 in 4 women my age are spending a huge portion of their time taking care of their parents. And trying to figure out how to afford this and how to afford that when Medicare for all will cover elder care. So I mentioned earlier that Bernie Sanders is the opposite of Donald Trump, and I want you to think about that in the next 43 days, I think, because the way we beat Donald Trump is by showing what the opposite looks like. And the way that we make sure there is not another Donald Trump who runs 4 years from now and wins 8 years from now is by having a President Sanders that leads a national cross-race, cross-class, grounded movement to actually make a real significant difference in people's lives. Medicare for all, a Green New Deal, forgiving college debt, the things that really can transform our country. So it is such an honor to introduce the future president, Bernie Sanders.
Thank you. Whoa. Thank you. Thank you all. Let me thank Andy Valinsky for his very kind remarks and for the extraordinary work he has done for education here in the state of New Hampshire and for what he will do with regard to climate change. I want to thank him very much. And as Zephyr mentioned, I've known Zephyr on and off for a very, very long time. And she has an incredibly distinguished career as a writer, as an academic, in taking on all forms of corruption in this country. And unfortunately, corruption is an issue that has got to be taken on, and Zephyr has done an extraordinary job in doing that. So I thank both of them for their support in this important election. All right, today we are going to discuss an issue that is of major consequence for everybody in the room, everybody in the state, and everybody in the country. Everybody deals with healthcare in one capacity or another. So let me start off by talking about the current system, because I think we don't do that enough. And I'm going to need your help on this, because I don't want to talk abstractly. I want to hear from you what's going on in your lives in terms of healthcare. So the first point to be made, I think the first question that we ask ourselves about healthcare, what is the function of a rational healthcare system? And no system is ever going to be perfect. No hospital is never going to make mistakes. No doctor is never going to make a mistake. But what is the overall function of a rational healthcare system? And it seems to me pretty clearly that the function of a sane and humane healthcare system is to provide quality healthcare to all in a cost-effective way. The function of a rational healthcare system is not one designed to make huge profits for the insurance companies and the drug companies. So given that premise, where are we today? Well, and this is a point that is not made often enough, we spend as a nation twice as much per capita on healthcare as do the people of any other country. We spend about $11,000 a year for every man, woman, and child in this country. That is roughly twice what the Canadians and Europeans are spending. So in other words, if I bought a car for $25,000, you bought a new car for $50,000, my car worked a little bit better than yours, something is wrong. And that's what you got. So it's not a question that we're not spending enough money, we are spending a fortune. We are paying by far, I'm gonna get into this in a minute, by far the highest prices in the world for prescription drugs. Dysfunctionality is when you go to a doctor's office and the doctor writes out a prescription and 1 out of 5 Americans cannot afford to fill that prescription because the price is so high. Can you imagine that? That you got elderly people in New Hampshire and in Vermont who are cutting their pills in half because they can't afford to buy the medicine that they need. Dysfunctionality and corruption is when I take a group of diabetics from the United States over the Canadian border a number of months ago to purchase insulin, and we buy exactly the same product for 1/10 the price, 10% of the price that it is sold in the United States, because the pharmaceutical industry owns the United States Congress and with impunity engages in price fixing and corruption. Dysfunctionality of the current system is about spending twice as much as the people of any other country, and yet having 87 million Americans uninsured or underinsured. And underinsured is the key word here, because you see a lot of statistics out there. Well, he has insurance. Yeah, well, you may have insurance, but you can't use the insurance because your deductible is so high. All right? So you got 87 million uninsured or underinsured. Dysfunctionality and cruelty is when 30,000 Americans die every single year because they don't get to a doctor on time. Next time you're in the doctor's office, ask the doctor if he or she has treated patients who walked into that office too late. And by the time they walked in, the situation was terminal. And the reason for that is people get sick. And they say, well, you know what? I don't have the $200 that I need. It'll get better. I won't go to the doctor's office. 6 months later, they go crawling in, and it's too late. We lose 30,000 people a year unnecessarily because they don't have proper insurance. And then there's another issue that we don't talk about enough, and I'm beginning to better appreciate the severity of this crisis. And that is that last year, some 500,000 Americans went bankrupt because of medically related debt. Now, I want you to think about cruelty. If you blow your money gambling, you decide you want to invest in some risky enterprise, you want to buy some huge house that you can't afford, and you go bankrupt, you know what? That's your problem. That's your problem. You're being irresponsible. But if you come down with cancer, if you are diagnosed with a serious heart ailment, if somebody in your family comes down with Alzheimer's or some other terrible illness, That is not something that should bankrupt your family. That is an outrage, something that should not take place in America. And it's not just bankruptcy. It's not just bankruptcy. I mean, you are seeing a situation where people's credit scores are being destroyed because they're paying their bills too late. They get the hospital bill, can't pay it, and their credit scores get shot, and then they end up paying higher interest rates for cars or whatever else they have to buy. So when I look at healthcare, I start off from the premise that healthcare is a human right, not a privilege. And this is not a radical idea. It's not something, that I invented in the middle of the night. It's something that most Americans believe in. In fact, it's what goes on all over the world. In fact, all over the world. You go into countries in Europe and you talk to the most conservative politicians there, it never occurs to them that all people should not be guaranteed health care as a human right, regardless of their income. So how does it happen that in America, we have been talking about, in one form or another, universal health care for well over 100 years? Teddy Roosevelt, way back when, beginning of the 20th century, talked about universal health care. FDR talked about it and wanted it, actually. Harry Truman talked about it. JFK talked about it. Lyndon Johnson talked about it and actually did something about it. Nixon even talked about it. Obama talked about it. Jimmy Carter talked about it. Everybody talked about it. And yet today we have 87 million uninsured or underinsured. What's that about? And this gets into what Zephyr and others are talking about. This is political corruption. This is not a debate about health care, because nobody can rationally defend the current healthcare system where we spend so much and get so little. This is about money. This is about power. This is about the drug companies spending $4 billion over the last 20 years on lobbying and campaign contributions. This is about the healthcare industry last year making $100 billion in profit while you can't afford the healthcare that you need. This is about whether we finally have the ability and the willingness to take on the greed and corruption of the healthcare industry. That is what this battle is about. And I think that after 100 years of talk, maybe now is the time for action. So we have introduced, as Zephyr mentioned, a Medicare for All piece of legislation. And let me briefly describe it to you. It's important that I describe it to you because what you're going to see on television ain't necessarily the truth. And that's because when you're taking on an industry that made $100 billion in profits, they're going to be advertising and lying in order to protect their huge profits and the CEO compensations that their executives earn. So what is Medicare for All about? First of all, we start with a program that is the most popular health insurance program in America. It's called Medicare. Been around since, I think, 1965. Is Medicare perfect? No, it is not. So the first thing that we do is strengthen Medicare. Anybody here on Medicare? Raise your hand if you're on Medicare. Okay, I got a gentleman right up here. Does Medicare cover dental care? Okay. Oh, retired military, different. Okay, yes. Does Medicare cover dental care? Does it cover eyeglasses? Does it cover hearing aids? Does it cover home health care? Medicare for All, our legislation, will cover dental care, hearing aids, eyeglasses, and home health care. So what we do is expand Medicare to cover all basic health care needs. Last I heard, dental care is health care. Last I heard, if you can't see, you got a health problem, right? Can't hear. How many elderly people are isolated from the world because they can't afford the $3,000, $5,000 they need for a hearing aid? All right, so we include that. So it's comprehensive health care. In 5 minutes, when we open it up, one of you are going to ask me, Bernie, we have a mental health crisis in America. Absolutely right. Does Medicare for All cover mental health? And the answer is, obviously it does. This is comprehensive health care. Mental health is part of a health care need. All right. So number one, we are covering all basic health care needs. We're not, if you want to get your nose improved, we're not covering it. All right, you're on your own. But all basic health care needs. All right, number two, how do you do it? What's the transition period? So you start off with Medicare for all. All of you know Medicare, to be eligible for Medicare today, you have to be 65 or older. So what we do in the first year is we expand Medicare to cover what I just said, and then we lower the eligibility age to 55. All right, a lot of folks in this room who are between 55 and 65 would give their right arm. I shouldn't use that metaphor. But we'll treat that too. But there are a lot of people who are closing in on 65 who are just hoping and praying they make it to 65 so they can get Medicare. So the first year, we expand Medicare and we lower the eligibility age to 55. Second year, 45. Third year, 35. Fourth year, everybody in America is in the program. That's about it. So that is the easiest way that I know that we can move toward universal, cost-effective, quality health care. All right, now what does Medicare mean? Medicare for all mean? And stay with me for this one again, because you're going to see a lot of distortions about this from my opponents and from the industry. Number one, we eliminate all premiums. Got it? Workers will no longer be paying premiums. Their employers will no longer be paying premiums. Number two, we eliminate all co-payments so that people will be able to go to the doctor regardless of their income. Not going to pay $50 or $100 to get into the doctor's office. Thirdly, and I want you to, what our campaign is about is trying to look at the issues a little bit differently than Congress does or the media does. One of the stupidest concepts imaginable is the concept of a deductible. All right? We take it for granted. We're all, well, what's your deductible? I've got to pay my deductible. Stop and think. When we talk about insurance, it means you paid into something and you're able to utilize it. Except for health care, you pay into something, sometimes a whole lot of money, but you can't quite use it unless you take out $5,000 or $10,000 out of your own pocket. It's an insane concept. So you're paying for something, but you can't use it, and if you're working class or lower income, you just don't have the money. You never get a chance to use your insurance unless you're hit by a bus or something. All right? So we eliminate the concept of deductible, which is an insane concept. And then we eliminate all out-of-pocket expenses. And under Medicare for All, because we are going to take on, big time, the corruption and greed of the drug companies, nobody in America will pay more than $200 a year for their prescription drugs. All right? Now, the next question, somebody is sitting there thinking, this sounds pretty good. Comprehensive health care, we're expanding it. I don't pay any premiums, no deductibles, no co-payments, no out-of-pocket. This is really good stuff. How are you going to pay for it, Bernie? I'm going to tell you how I'm going to pay for it. But before I tell you how I am going to be paying for it, and everybody asks me, all my opponents and the media and the drug companies, are, how are you going to pay for it? Let's ask for a moment a question that we don't ask. How are we paying for it today? I am assuming that in this room and in this state and in this country, not everybody has quality health care for free, right? All right, you are paying for it. How are we paying for it today? So let's ask that question and see if the way we are paying for it today makes any sense whatsoever or is in any way vaguely fair. All right, let's start off with premiums. And I'm going to ask you a question. Please don't be embarrassed. You're not the only one. Please tell me what kind of premiums people are paying a month or a year. Right here. 800, all right, $800 a month. Stand up. Come on up here, ma'am. We're going to put you on TV, but I don't know that they'll cover it. All right, now, what's your name?
My name's Liz Hunt.
Liz? All right. Before Liz speaks, remember, every day, Bernie, how are you going to pay for Medicare for all? All right, Liz, tell us how we're paying for it today.
So for a family of four, I'm paying $800 a month for insurance that, as Bernie pointed out, I really can't afford to use because for my family, I have to meet a $12,000 deductible. So I'm not a wealthy person. I am a nurse practitioner, but working for a nonprofit that provides health care that's funded by public funding. In 10 years, I've had 2 raises. So as cost of living goes up every year, I'm not keeping up with that. In addition to that, every time I turn around, I have a copay. So in addition to having to meet that $12,000 deductible, I'm still paying a copay that doesn't necessarily go toward that deductible. That's a separate charge. So I have to admit that I have edited my health care. I've made decisions about what I will or will not take. Dental care is something that I've put off, which I regret very much. But, you know, you do what you can do. I have 2 kids in college. Thank you.
That's how we're paying for health care today. And, you know, obviously, depending on the health of the people in Liz's family, it'll be more or less, but it sounds to me like she's paying up to $20,000 a year for a working class person. Yeah? That's outrageous. That is simply outrageous. Who else wants to talk about how we're paying for it today? What are you paying today? Premiums, deductibles, thoughts? Don't be shy. Yes, sir.
I pay for it by not being able to take a job that would pay me enough to pay my rent, because if I do, then I'll lose the benefits that I have. I'm on Medi-Cal in California. Now, if I make a certain amount of money per month, then I lose everything, and I have type 1 diabetes since I was 11, and then I'll start paying through the nose for insulin and insulin supplies and blood testing supplies and all that, and doctor visits. And I won't be able to afford to live, basically, and that's how I pay for it.
Everybody hear that? What's your name, sir? Jim. You ever hear Jim? So Jim, I don't know, I never met Jim, but I think would like to go out and get a job, but if he gets a job, he loses what keeps him alive. Is that what you're saying? How insane is that? All right? Jim is not the only person in America in that position. And let me tell you something else. There are millions of people in this country today who are doing jobs that they don't want to do. They don't like their jobs. They want to do something else. They are on their jobs because they're getting decent health coverage for their families. So you got people who would love to do, maybe start their own business or do whatever they want to do. They can't do it. They're trapped in a job because, like Jim, they are getting health care benefits that keep them and their families alive. All right, further discussion on how we pay for health care today. Ma'am, do we got a mic here? All right, we got a mic? So this is a tight-fisted campaign. All right, Mo, you got, all right, here you go. Okay.
I don't. This is my employer. It's my husband. We don't have a corporation behind us paying part of our health care. It comes off of the sweat from him and a little bit from me. And I'm lucky that I'm healthy. But this year had some things happen, wanted to check them out. I met my deductible, $7,000, my individual deductible, but look at the date. It's the end of December, and it resets in January. What good is that?
I mean, what's your name, ma'am?
Laura.
Laura raises another issue. I mean, we go on. This is the insanity. You can't get sick early in the year. So presumably if you needed some tests done in January, based on what you learned in December, you're gonna have to put it off. Am I missing something, or is this totally insane? I mean, this is what the system is about. This guy can't get a job because he needs to have public health to stay alive. She can't get her tests because the deductible kicks in again in January. She's paying a significant part of her income, limited income, for health care that she can't afford. All right, I see some hands over there. Do we have another mic? Yeah, okay. Stand up and give us your name if you could, please.
Yeah. Is it working? Okay.
Hold it close to your mouth.
Yeah, that would help. I fall in a bracket where I do not have enough money to afford a health insurance plan, but I also don't make enough to actually get a health insurance plan, even the one through my work. So currently, right now, even though I work for the government as a civilian contractor on Portsmouth Naval Shipyard, I have no health insurance at the moment. And I have to pay for every doctor visit, every drug, everything completely out of pocket.
Okay. And I just out of curiosity, what's your name, sir? Give him back the mic if you could, please. Yeah, give him back the mic. What is your name?
Oh, my name is William Blake.
All right, William, I mean, what would happen if, God forbid, in your situation now, you were diagnosed with a serious illness? What happens to you?
I would not be able to afford treatment, and I would have to deal with what comes.
Okay.
Given the absolute worst of the circumstances, and wouldn't be able to afford any of the care that is necessary.
Okay. This is how we pay for health care today. And I can go around this room and we'll hear more and more. Self-employed people paying far more than they can afford with huge deductibles. People risking their lives by not having any health insurance at all. All right? Yes, I see a hand here.
I have a question on Medicaid.
Okay, I'll tell you what, I'm going to take your question. Hold on for a second, if you could, please. I will get to you in a minute, okay? But this is how we are paying for it today. And I think the way we are paying for it is cruel. It is unacceptable. So what do we do? How are we going to pay for Medicare for all? Am I going to sit here and tell you that comprehensive quality health care is free to everybody? No, I'm not going to tell you that because you wouldn't believe it, and it's not true. Health care is pretty expensive. How are we going to pay for it? Well, we pay for it in a rational way, which does not mean that some people put their lives at risk. Other people pay a huge percentage of their income. What we do, among other things, it's complicated, there's a lot of stuff out there, but how it applies to working people in general is the following. What we say is, with no premiums gone, no co-payments gone, no deductibles gone, no out-of-pocket expense, paying no more than $200 a year for prescription drugs, you're going to pay 4% of your income in taxes, exempting the first $29,000. The median family income in America is $60,000 a year. That's the family right in the middle of the American economy. For that family, they would be paying 4% of their income on $31,000, which is a little over $1,200 a year for comprehensive health care. How's that? Okay, and that is by far, compared to any other plan that is out there, by far the most cost-effective way to pay for healthcare. That is a fair way. If you're lower income, under $29,000, you don't pay anything. If you're making $40,000, you're paying 4% of $11,000, not a whole lot of money. That is, if you're very rich, you're going to pay more. All right, that is, I think, a fair way to pay for it. Also, there's to be a tax on employers who no longer have to pay premiums, but they will have to pay a tax. They will do better as well. So, to my mind, that is the sane, the rational, and the humane way to go forward to provide health care to every man, woman, and child in this country. Also, I would add that when you have a healthcare system not designed to make huge profits for the insurance companies or the drug companies, you change your healthcare priorities. You put a greater emphasis on primary care so that people can get to a doctor or a dentist when they need to. You put a greater emphasis on disease prevention so that we can keep people healthier and not getting sick in the first place. So that, at the end of the day, is what Medicare for All is about. And the reason that we have been talking about issues like this for over 100 years has nothing to do with the debate over healthcare. It has to do with the profits, and it has to do with the power of the drug companies and the insurance companies. And what my promise to you is that in the first week of my presidency, we will introduce a Medicare for All single-payer program, and we will win that fight. Okay, I want to say a word before we open it up wide up. I want to talk about prescription drugs, or ask it your views. How are we doing with the pharmaceutical industry? Nice guys? I saw an ad that they're working overtime to make sure you get quality, affordable prescription drugs. They're just staying up nights worrying about you. All right, experiences with drug prices. Who wants to talk a little bit about that? Anybody have some thoughts? I see a hand going up over there.
Thank you. I've had to get a few prescriptions in the past 6 months, and I just have to pick and choose at this point. I had a prescription given to me for an ear infection that I get to the pharmacy to find out is going to be over $100 because of the prescription, the health insurance that I have. So I just walked away from the counter, Googled, went into one of the grocery aisles, bought some apple cider vinegar, and hoped for the best.
Okay. But this is not a laughing matter, I must say, because there are illnesses that are life and death illnesses, and I've talked to too many people who have lost loved ones because they can't buy the medicine that they need. More on prescription drugs. Thank you, sir. Yes, ma'am. Can we get a mic right here? Now, here, why don't you get our mic? All right, got it? There it comes. It's coming down the aisle.
I don't know why I'm doing this, but
Hold that mic close to your mouth.
I had cataract surgery a couple of years ago, one eye, then the other eye. And I was having trouble with one of the eyes. One is closer and the other one's farther away, and that isn't what I asked for. But I was having the dry eye syndrome, and the medication samples that the eye doctor gave weren't working. And so I went to the doctor that did the surgery on my eye, and I asked him what he takes. And he told me it was PRN, not a pharmaceutical, but it's eye omega stuff, and it's very expensive for me. And so I started taking it because I wanted to not have to, have the problem with the eyes. So then they went up again, and I went to, I have my eyes checked by my doctor, and I said, I can't afford this. And so she sent me to the specialist in Portland, and he said, here is a prescription for Zydra, I'm not sure. It's a new eye drop that has come out, and it works wonders. And he gave me a prescription for it to try it for 30 days. And I finished I didn't take it right away, but I finished my eye omega first. And then I went and read all the information about this new drug. And it says that Medicare doesn't cover it, or Medicaid doesn't cover it. And so I went and asked Hannaford, why would they give that to me? And they said, it's $200 a month if you don't have the right insurance for it. So I called that doctor and I said, why are you dishing that out to senior citizens when they can't even get it anyway? $200 a month because it's a new drug and there's no
And the drug companies
Other.
can charge anything they
anything
want.
they want.
Okay, thank you. All right, other thoughts on issues of prescription? I see a hand right here, ma'am. Mo, to your right, your left. Okay.
I think you'll find this.
Hold the mic close to your
I
mouth.
think you'll find this rather interesting. We lived in Europe for 13 years, and he has these very expensive eye drops he has to take. Plus, he has asthmatic problems, so he has inhalers. The eye drops that he gets run anywhere from $80 to $120 for a little vial like this. In Europe, it's €2.50.
For the same product?
Exact same product.
Yep.
Exact same pharmaceutical company, this exact same product. Then his inhalers, one of them here costs $360, and that's a month's supply. There, it costs 35 euros. So every once in a while, we'll go back to Europe. And our trip gets paid for. I figured out last year.
That's right. That's right.
We paid 430 euros, and it would have cost here $9,500.
And by the way, thank you very much. And by the way, there are millions of Americans. Back in 1999, I believe, some of you may remember, I don't know how much attention it got in New Hampshire, but I took a number of people from northern Vermont over the Canadian border to buy prescription drugs for one. It was breast cancer what the women were dealing with, 1/10 the price. And I think out of that, other senators and congressmen did it. And now millions of people are buying their medicine abroad. But the bottom line is, we should not have to do that. There's no reason why an inhaler or an eye drop should be costing 10 times more in this country. All right, let me open it up in a minute, but I just want to say, people are saying, okay, how are we gonna save all this money? And here's the answer. Not only are we dealing with the greed and corruption of the drug companies and the insurance companies, we're dealing with an enormous administrative nightmare. In this country, there are thousands of separate insurance plans, all right? You have a $10,000 deductible, you got a $5,000 deductible. You're in this network, we didn't even talk about networks. Don't get sick when you're out of your own network. Make sure where your network ends, don't step over the line, because then you're gonna have to pay out of pocket, right? All right, so you got all of the, you covered, we heard today, some plans cover this prescription drug, some plans cover that prescription drug. Think about how much it costs to administer thousands of separate plans. All right, in Canada, and we build on that, you got a card, you go in, that's it. They note what you do. You don't take out your wallet, you don't take out your credit card. You have a major surgery, you're in the hospital for a month, there is no bill. And one of the reasons we can provide comprehensive health care to all people at far less cost than you're paying right now, is we end A, the profiteering of the insurance companies, and B, we end the administrative nightmare where we're spending many hundreds of billions of dollars trying to administer an enormously complicated system, okay? So that is, get rid of that administrative waste, you get rid of the profiteering, you put that money back into healthcare, we can lower the cost, expand coverage for every man, woman, and child in this country. So all that I'm asking you, when you turn on the TV and you hear people attacking me as to how I'm gonna pay for it, you heard about how we're paying for it today, just some of it. There are a lot more stories out here. And understand who is putting those ads on television. It is the drug companies that are charging you 10 times more in this country than they are in Europe, because in Europe they are regulated. It is the insurance companies who will do everything they can to maintain their profits. Okay, questions, comments? Open it up. I see a hand over there, sir. Wait for the mic.
So I'm probably going to bring a different perspective to you. I'm a father of 4 kids, very progressive. My wife and I are here trying to decide between you and Elizabeth. But I also work as a grievances and appeals analyst for one of the major health insurance companies. So my question to you is, I work with thousands of really hardworking people, doctors, nurses, who try to make the best decisions we can under the guidelines that we're given. So under Medicare for All, what does our job look like? What are we unemployed?
What is it? Tell me what your job is.
I'm a grievance and appeals analyst for.
So what does that mean exactly? Give me an example of what your day is like. Who's coming to you?
So say you you're in the hospital, and
I am appealing a decision of the insurance company?
Of the insurance company.
I thought I was covered, but you're going to tell me I really wasn't covered.
Right.
Is that?
Yeah.
Well.
So I guess my question to you is, under Medicare for All, are all the insurance companies just working under one general plan, and then?
Yeah, there's going to be, yes, there will be a government, it'll be an expansion of Medicare to cover all people. Will there be some administration? Yes. Will there be anywhere near the kinds of administration that we currently have? No, there will not be. Because I want you to look, and I don't mean this to be, what's your name?
James.
James, this is not personal, James. All right, but let's just say I'm in a hospital, and I thought my policy covered me, and it turns out I got the bill and it didn't, right? And I call you up and I say, hey, James, I thought I was covered, right? That's good. And you have to explain to me why I'm not covered, right?
Don't.
Or maybe you help me get covered, whatever it may be, right? But that's your job.
Yeah.
What we have to do is to make sure people should not have to argue with you or anybody else. If they are sick, they deserve the coverage. And that's what Medicare for All is about. So to answer your question, will there be job loss? Yes, there will be. But what I want to tell you is we are putting into Medicare for All what we call a just transition program, which will help everybody in the industry for a 5-year period maintain their income, get the job training that they need to get another job. I think that's the fair and right thing to do. Okay? Okay, I see a hand right here.
Hey, Bernie.
How you doing?
My name's Casey.
Hey, Casey.
What happens to my medical bills after you become president?
Well, we got another piece of legislation that would forgive medical debt in this country. Are you being hounded by bill collectors now?
Oh, yeah, and I have another situation. I'm unemployed and the primary caretaker of my elderly parent. So I have no income. I have no insurance.
And you owe medical bills?
Yes.
And what's happening to your credit? Is it being...
What credit?
Okay. All right, here's another example of, in my view, and we have legislation that would do that, is right now often medical debt is going to some bill collector who gets pennies on the dollar. They're going to hound you to get their money, and they get, I don't know what they get, 5-10 cents on the dollar. We think that that's wrong, and that debt should be taken away from you. You know, if it's a medical debt, it's not something you should be dragged down with for the rest of your life.
Thanks.
Okay. Okay. Yes, ma'am. No, you got a mic right there.
Hi, my name is Diane. I'm very fortunate. I have a very good retirement supplemental plan, and it's paid for by citizens of New Hampshire, actually, because I was a state employee. But every year, we don't know what's going to happen, so that anxiety is a little tough to deal with. We don't know if the legislature is going to support us or not, or whether the state residents will support us. But I wondered, what do you expect to happen with the supplemental that we are now paying from our...
That's gone. Explain to me so everybody knows it. What does the supplemental cover?
It covers what Medicare doesn't cover.
Which is, in your case? I know, you pick and choose each person.
Probably the...
Prescription drugs you get covered?
Yes, but not totally.
Okay.
Some out of pocket. Really, it covers a lot.
Yeah.
I mean, we're really so fortunate. That's why I said unfortunate.
You won't need it.
Okay.
Because Medicare for All will cover everything.
So that will help the state a great deal.
Yes, it will. It will help every employer.
Right.
Including state governments.
And I also wonder what happens with the money that's taken out of our Social Security now for Medicare. We pay approximately $140 a month.
Well, you're going to be paying taxes on income, that will disappear. But you will be paying a new tax, 4% of your income.
And
But
will that be for those who are really high earners? Will there be a cap? You know, like a guy who makes $1 million,
no,
does he pay 4%?
this is going to be a progressive tax, and people on top will be paying more. Okay, I see a hand way in the back. Yes, ma'am.
Hi, I've been wondering about our public employees, federal, state, local, how the transition would work. As an example, I've been serving on a school committee for a long time, and every year, budget season's coming up, and every year, right now in the community I live in, a family plan costs $32,000 for a teacher that the school system pays, not to mention what the employees pay.
You're paying, the school system is paying $32,000 plus what
For a family plan,
plus what
yes.
the teacher is paying.
And they have again, there's the deductibles and there's the co-pays, because I'm also a provider and I see what they have to pay for co-pays. So how will that transition in, and why don't we talk about, as taxpayers, because every year we have to talk about, can the teachers get a raise?
Right.
Or how does that balance it out with their benefit package?
Excellent
So
point.
how will we, why don't we talk about how much taxpayers will pay in all their taxes
Good.
with this?
What's your name, ma'am?
Kendra.
Kendra. Thank you, Kendra, for raising a very important issue. Just yesterday, I was in Concord with some state employees who are negotiating with the governor about their pay raise. And I think all over the country, when you have a union, is that unionized group that you're negotiating with? All right. Time and time again, whether it is in education or you name the area, much of the negotiations comes down to healthcare. And often what happens is the employer, and you correct me if I'm wrong, and I, Kendra, says, look, we're spending a fortune on healthcare, and if you want to maintain what you got, we can't give you a good raise. Is that right? More or less, and that's kind of the discussion. And sometimes employees will give up and end up paying more for healthcare in order to get a raise, or vice versa. And one of the beauties of Medicare for All, Kendra, guess what? You're going to end that negotiation. Your teachers then can sit down and talk to you about wages, working conditions, education, not have to spend half their life talking about healthcare, because you will have coverage, school board will have coverage, the teachers will have coverage, and everybody will be covered. And this is not a radical idea. This is what exists in virtually every country on earth. I was a mayor for 8 years in Burlington. And trust me, we spent a lot of time trying to figure out how do we get the best health care benefits at the best price for our workers. You don't have to do that under Medicare for All. So for not just school boards or cities, but for private employees, you're a small business person, and I'm sure we have some of them here, and you're trying to do the right thing for your employees, but it costs you a fortune, all right? So what I'm saying is that's on the table. You're going to be covered. Your family, employees are covered. Yeah, then you pay a certain percentage of your income or payroll tax if you are an employer. It is a simpler system. It is a fairer system. And for workers and employers, it will save an enormous amount of effort. You don't have to go through that stuff again. Now, wouldn't it be nice to sit down and argue with your teachers about education rather than about healthcare? Okay, I see a hand right here. Yeah.
Thank you very much, Bernie, for everything you do for us.
Thank you.
I'm just wondering how we accomplish this without a supermajority in the Senate with the amount of money that's coming in from pharmaceuticals and insurance companies.
Do not hesitate for 1 second in thinking that this legislation will require 60 votes. All right. This legislation will require 50 votes plus our vice president, whose name has yet to be determined. And we will do that through, and I will not bore you in what is clearly the most boring subject in the history of the world, is Senate rules. But there is a process called budget reconciliation, which means that major legislation, and I didn't invent it, major tax cuts for the rich were passed through budget reconciliation, 50 votes plus the vice president. So we will not deny the American people the health care that they need trying to get 60 votes. We will do it through majority vote. And by the way, that question touches on a broader question, which I am asked all of the time, and it's a fair question. And that is, you got an ambitious agenda. It's not just healthcare, it's education, it's criminal justice, it's immigration reform, it is wage increases, it's the economy. How are you going to accomplish this? And the answer is that what I believe from the bottom of my heart, and I have always believed, is that real change, and what we're talking about today is real change. Medicare for all will finally do for the American people what has been talked about forever, is that real change never ever takes place from the top on down. And the reason that the message of our campaign is us, not me, is that what we are trying to do, which is frankly unprecedented, I must say, is create an economy and a government that work for all of us, not just the 1%. And the way that happens right now, and this is what Zephyr spends her life studying. I mean, the way this happens right now, and I'm a senator, is the major piece after piece of legislation is written by lobbyists representing the wealthy and the powerful. That's the way it is. We are going to change those rules, and I believe that especially when we have the bully pulpit of the presidency, when we hold meetings like this in Kentucky, where Mitch McConnell, you're going to hear the same people, you're going to hear self-employed people. I can't afford it, Mitch, do something. I'm uninsured, Mitch, do something. I lost my husband because he couldn't afford prescription drugs. Do something. Stop worrying about your rich friends and your corporate allies. Do something for working families. We will hold these meetings, not just in New Hampshire and Vermont. We're going to hold them in Kentucky and in West Virginia and every damn state in the country. And what we will... And I think the beauty of these meetings, and why I love these meetings, I truly do, is when you have people brave enough to stand up in front of a mic and say something, you don't know it, a lot of people nodding their heads, because your position is not unique. Millions of people all over the country in this room who don't want to be in front of a TV camera are experiencing the same pain. And the more we talk about it, and the more we move away from big money interests who are dominating the political process, that is when real change takes place. So it's not only passing legislation with 50 votes, it is making sure that the American people are united in standing up for justice, whether it is healthcare justice, whether it is environmental justice, whether it's racial justice, whatever it may be. And that's what I will attempt to do as President of the United States. Okay, we got time for a few more questions. Ma'am, right here. Okay, yes, grab the mic. Grab that mic, hold it close to your mouth.
2.5 years ago, I was diagnosed with brain cancer, and over my treatment and everything, basically, I kind of learned some stuff, and I learned that in all the money that goes towards cancer, only 4% of it is for pediatric cancer. And if you were president, I would like to see what you would do about that.
Thank you. Thank you for being so brave. Thank you. Disease is a terrible thing. When it strikes our kids, it is even more terrible. So my promise to you is we will put substantially more money into research for pediatric illnesses, all right? And also, what we will do is put more money, I mean, it goes on and on and on. We will put more money into research which develops cures for the most serious illnesses facing us. You know, the drug companies will tell you that they're spending a lot on research and development. Often, not always, but often what they are spending on is trying to modify an existing drug so they can get a patent and then sell it, and that drug really doesn't have a profound impact on people's health. You know, we are dealing with issues like cancer. We're dealing with issues like Alzheimer's. We're dealing with issues like diabetes. Many other serious illnesses that require a lot of research. And it makes all the sense in the world for us to invest heavily in research and development, and especially to do everything we can to prevent these childhood diseases. Okay, maybe one or two last questions here. All right, this gentleman. Yeah.
My question is this, all right? Now that we're going to go to Medicare for all, I assume every state has a Medicaid bureaucracy that administers Medicaid. Won't Medicare for all save this money by, we won't have this double standard?
That's right, of course.
Okay, that's what my question.
Yeah.
And one other quickie, all right? I think the $15 an hour is fantastic, but if Congress doesn't pass a bill to guarantee that that is adjusted for the cost of living every year, 10 years from now, we're going to have a look at another
yes.
Bernie Sanders to fight for us for $25 an hour.
Yes, you're right on both counts.
Thank you.
Okay. The bill that I have introduced does keep pace with inflation. By the way, maybe we'll end on that note, because I want to thank the people of New Hampshire. And I want to talk a little bit about how change takes place, because you have been part of that change. You may not know it. I came here, as all of you know, 4 years ago. And by the way, thank you very much for the help you gave me 4 years ago. We won here. But it's not just me. I want you to know what you did, what New Hampshire did. Iowa to some degree, but New Hampshire more. And that is, when I started the campaign, you recall, and I talked about a $15 an hour minimum wage. And I talked about making public colleges and universities tuition free. And I talked about climate change being a major, major crisis for our country and the world. And I talked about healthcare as a human right, and criminal justice reform and immigration reform, and protecting a woman's right to control her own body. And talked about all of these issues. What the political establishment and the economic establishment and the media establishment said, Bernie's ideas are so far out there, nobody will support him. He's an extremist. And then we came into New Hampshire and we won this state by 20 points. All right? So here's my point. My point is, it's not just me. I thank you, for helping me win. But what you did in that vote is you showed America that these ideas that stand for the working people of this country are not radical. That what is radical is giving tax breaks to billionaires. And that's what New Hampshire did. And we left New Hampshire, we ended up winning, I think, 22 other states. And we got 13 million votes. And that helped transform the entire political conversation in America in terms of what is possible and what is not possible. And now, at this moment, we have won, I think, the intellectual debate about where we need to go as a country. And now it is our time to implement that agenda, which will not be easy, because I want all of you to know that we are taking on Wall Street, incredible power. We're taking on the insurance industry, the pharmaceutical industry. We didn't talk a word about climate change and the need to take on the fossil fuel industry. We're talking about the prison industrial complex. We're talking about the military industrial complex. We're talking about the whole damn 1%. It's not an easy fight. It is not an easy fight, but I think the time is now for us to roll up our sleeves and to engage. So our job is not only to defeat Donald Trump, the most dangerous president in the modern history of this country. Our job is to create a government that works for all of us, not just a handful of billionaires. Thank you all very much.